HarperCollins presents Gynae Geek, your no-nonsense guide to down there healthcare, by Dr. Anita Mitra, read by Dr. Anita Mitra. Introduction. Down there healthcare by the Gynae Geek. It's 3 o'clock on a Wednesday afternoon, and I've just performed a surgical evacuation on a woman who was 9 weeks pregnant before she miscarried. I'm in theatre, writing an operation note, when my bleep goes off. It's A&E. I speak to a worried-sounding nurse who asks me to come urgently and see a patient. 41 years old. Bleeding very heavily. Not pregnant. Hemoglobin is 4 and... What did you say? 4? I jump in. Yes, doctor, 4. Okay, I'm coming. Put her in resus, and put in a large cannula if you don't already have good IV access. Oh, and what is her pulse? 107. Okay, I'm coming. I'm worried. Why is this patient's hemoglobin level almost 1/3 of what is normal for a healthy female? I scrawl the rest of my notes in my best. I'm in a rush, but I'm trying to make this as legible as possible. Handwriting. A skill that's almost second nature now. I grab a disposable green paper gown to cover my theatre scrubs and run down the corridor to A&E. I enter the resus department, my gown fanning out rather dramatically behind me, and I rush into the patient's cubicle. She is hooked up to a machine that is beeping wildly because of her racing pulse, and there is a lot of blood on the bed. The nurse I spoke to on the phone looks concerned, standing over the patient, who seems surprisingly calm, albeit slightly clammy. I ask her if she's sure she isn't pregnant. She laughs and tells me it's impossible, and the nurse confirms the pregnancy test is negative. She tells me she's having her period, but it's much heavier than normal. I ask her how many pads she's been using. Pads? She asks. Oh, I don't normally use those until day 2 or 3, when things have settled down. I normally take the first day or 2 off work and sit on a folded-up bath towel, because there's so much bleeding. Today it was so heavy, though, that I was just sat in the shower for a few hours, washing away the blood as it came out. But I didn't feel very well, and I think I might have passed out, so I called an ambulance. I look at the patient, who is slightly obese and of South Asian descent, which, along with her symptoms, makes me begin to suspect she has a cancer. I ask her how long she's had this bleeding. Probably about 20 years? 20 years. No wonder her hemoglobin is 4. In fact, I'm surprised she's made it this far without ever having had to come to hospital, especially as she's been losing iron at the speed of sound for 2 decades. I perform an internal examination and blood clots the size of my palm begin to fall out of her vagina. Then, miraculously, the bleeding seems to stop. I wait for a few seconds to see if more blood will come out. Nothing. I wait some more. And some more. And then there's another steady trickle. I instruct the nurse to get me some IV tranexamic acid, which is a drug to stop bleeding. I ask her to get it urgently, which she does, and I administer it myself. I prescribe a blood transfusion and tell the nurse to give some IV fluids to stabilize the patient while we wait for the blood to be cross-matched in the lab. I also prescribe tablets to slow down the bleeding. As I wait to give the tranexamic acid time to work, I ask the patient, trying not to sound patronizing, why she has never sought help for her heavy periods. She tells me she had come to think it was normal, and either a few years ago, when she began to suspect it was not, she was too embarrassed to discuss it with her friends or family, or to go and speak to her GP. As we talk, her bleeding slows down, and I arrange for her to be transferred to the gynecology ward. She will be observed and receive a blood transfusion, although I have no idea at this point that she will need 4 units of blood. Walking away from A&E, I can't believe what I have just seen, and I realise I will never get over the shock I feel when patients drop this kind of bombshell, nor will I ever truly understand the extraordinary things some people accept as normal. If you're still with me and are not feeling too queasy from my casual Wednesday afternoon bloodbath, let me introduce myself. My name is Dr. Anita Mitra, BSc, MBCHB, PhD. I'm a London-based doctor, qualified in 2011, and I'm now training to be a specialist in obstetrics and gynecology, which we often abbreviate to O.
Sample complete. Ready to continue?